All right, we're now recording. We'd like to welcome everyone to the Mid-Atlantic Women in Agriculture Wednesday webinars. We have these the second and fourth Wednesday of each month. You can see the upcoming webinars that we have listed, many more on the site, and we'll be finishing out 2018 dates pretty soon, dates and topics. There in the blue is the web link where you can find upcoming webinars or any of our archive webinars and recordings. We again would like to thank everyone for the successful 2018 Mid-Atlantic Women in Agriculture Conference, and also announce that the 2018 Annie's Project classes, we still have one that will be starting soon. We have two that are going on currently, and one will be happening in Central Maryland next month. So more information, again, can be found there in the blue link. We'd also like to recognize our sponsors for the programs that we offer, and our collaborators there at the bottom for the program itself. So with that, I'm going to go ahead and turn today's session over to Jesse Ketterman. He's going to be talking about smart use, health insurance, smart actions. So Jesse?
Thank you, Shannon, and hello and welcome. Today I'm going to be talking to you about smart actions that you can use for your health insurance, and hopefully I'm going to share 7 actions that you're going to be able to walk away with and become a smart user of health insurance. And again, my name is Jesse Ketterman. I'm an extension educator in the Western Cluster of Maryland. I have an emphasis on financial literacy and health insurance literacy, and I'm an accredited financial counselor. My colleague today is Maria Papitas. Unfortunately, she was unable to join us, but I do appreciate her support in putting together the presentation today. So as we get started, I want to kind of touch on a couple elements that we use. We have the chat box there. There will be a couple questions I'll post along the way. Just make sure that when you use the chat box that you send it to both Shannon and I, so both the panelist and the host, so that we can both see that questions. And then we'll also be using the polling feature on the right as well. Now I'm going to send you, we're trying to gather some data about this program. So I just posted in the chat box a link. It's to a Qualtrics survey. And if you could open up that link, complete the survey, finish on that screen, but minimize it after that because there's also going to be a post survey to complete there. So open up the link, complete the survey, hit next, and just minimize that screen so you can pull it back up later on as we go. And I'll give you a minute to do that. If you could just type something in the chat box to let me know that you've completed that, I would appreciate it. That way I can know that we can move forward. And like I said, I'll give you about a minute to do so, and then we'll get started. Again, we are collecting data, but we are not collecting any personally identifiable information. We do have IRB approval for this, and all that should be available on the link. But if you have any questions, feel free to let me know. And like I said, once you've completed the survey, just type something in the chat box, and that way I know that you're ready for me to advance to the next slide.
And Jesse, where is the link to the survey?
I posted it in the chat box to all attendees. So you should see it on the right of your screen.
It did not come up. There we go.
Okay, so there we go. I think the first time it went to all attendees. I sent it to all participants this time. So I'm going to move us forward. Today, what I'm going to cover is how to understand and how to use your health insurance, to learn how to manage your health care expenses, and to identify some tools that you can use when you need to solve a problem. And one of the things that I want you to think about is, how does health insurance fall into your risk management of your farm operations? Because it is an important issue, and that when a health insurance matter arises, there can be significant cost to that. And so I want you to think in the back of your mind is, how does this apply to my risk management operation? I'm also going to be sharing with you after the presentation's over several materials. Shannon's going to send this out for me that kind of go along with this presentation. I will refer to them at different points throughout the presentation, but as you can see, I'm going to send you something about saving for health and medical expenses, health flexible spending accounts and health savings accounts, important terms to know, some tools that you can use to help estimate cost. And these materials are also available on our website that I'll share at the end of the presentation as well. So I'd like to start off, if you could post a response to this question, is why is it important to be an informed health insurance consumer? So if you could share your thoughts there, I would appreciate it. But why do you think is it important to be an informed health insurance consumer? And I see someone just completed the survey. Thank you. And so now I'm looking for people to post in the chat box why it is important to be an informed health insurance consumer. So to be sure that you have the right coverage. Very good. Very good. See if we can get one more response, and then we'll move forward. So as people are responding, one thing is you need to, using your health insurance, it's important because keeping healthy allows you to continue to farm, work, or attend school. So we know if people, and I can see kind of a response there to be sure that you'll be covered for the unexpected. Absolutely. But we know if people are engaged in using their health insurance, that, again, they're more productive. They can farm, they can work, they can attend school. And again, you don't have lost productivity for issues that you have avoided by not using your health insurance. So that's one element there. Prevent and manage chronic illnesses, so things like diabetes, those things need to be monitored and maintained. To take advantage of preventive services, routine visits, screenings, all those things are important to stay healthy, and again, so it doesn't impact your ability to farm, work, or attend school, as I mentioned earlier. And the other element there is to save money and avoid costly problems. And again, utilizing your health insurance and preventive care is going to allow you to save money, so you're not dealing with a bigger issue later on, and it can help avoid those costly problems. So now I'd like to share a little video with you, and we'll see, get it uploaded here.
Referral.
So as you can see from the video, you know, it can be confusing because there's going to be a lot of terms that you'll hear health insurance providers talk about, and you may not understand what they are, what they mean, and so knowing what those important words are an important element to using your health insurance and to be a smart user of health insurance. And so what I'm going to do, I have some polling questions around some terms, and so I'd like for you to look on your right. There should be a poll that pops up here, and you can see it says, what is a copayment? And there are your options. Option A is a set amount that you pay for a covered service when you get the service. B, part of the cost of the covered service. C, the amount you owe for health insurance services your health insurance or plan begins to pay. It should be before your health insurance plan begins to pay. So we'll close the poll here in about 15 seconds, so if you could choose your answer. And so looks like some of you said you're part of the cost of covered service. Actually, a copayment is A, which is the set amount you pay for a covered service when you get the service. You're part of a covered, or you're part of the cost of a covered service is a coinsurance, and then the amount that you owe for healthcare services before your health insurance or plan kicks in is your deductible. So let's go to our second polling question. It should pop up on your screen now. Is what is an exclusive provider organization? And option A is a plan that covers services only if you go to doctors, specialists, or hospitals on the plan's approved list. B, a plan that only covers care from doctors who are part of the HMO. C, a plan in which you pay less if you use providers that are in the plan's network. And D, a plan that has a special network or group of providers. So take a minute, choose what you feel is the best option, and then we'll close the poll, and I'll go through the answers. Give it about 20 more seconds. All right. And let's see what our answers are. We have, it looks like everyone got this one right. It's A, which is a plan that covers services. So an exclusive provider organization is a plan that covers services only if you go to doctors, specialists, or hospitals on the plan's approved list. B, of course, the answer is kind of in the question there. A health maintenance organization is a plan that covers care from doctors who are part of the HMO. And then you have a POS, or a point of service, which is a plan which you pay less if you use providers that are in the plan's network. And then you have a preferred provider organization, which is a PPO, which is a plan that has a special network or group of providers. And I believe we have one more polling question for you. And you should have the poll up now. And the question is, savings plans that help you save money pre-tax to help cover qualified medical expense. And your options are a flexible spending account, a health savings account, a health reimbursement account, and all of the above. Give everyone about 30 more seconds. All right. And so it looks like the majority of people got that correct. It's all actually all of the above. And so a flexible spending account is a plan through your job that lets you put pre-tax wages into a special account. The money can then be used to cover medical costs, child care, and other health services. And you decide how much of your pre-tax wages you want to put into your flexible spending account. And the advantage, of course, is with all these, you know, pay taxes on the money. The health savings account is an account that lets you put money aside tax-free and save and pay for qualified health care expenses if you are enrolled in a high-deductible health care plan. And then the health reimbursement account is an employer-sponsored account to, again, with a tax advantage to it to reduce the cost of medical expenses. And again, reducing cost in terms of tax savings. And so, like I said, the answer is all of the above. And so, one of the documents I'll be sending out to you is this smart choose, smart use, important words to know. And you can see these are all terms that we feel it's important for you to know if you're going to be a smart user of health insurance. And like I said, I'm not going to go through each of them. I'm just sharing the document with you so that you can be aware of what I'll be sending out as we finish up the presentation. So now I want to jump into 7 smart actions that you can take when using your health insurance. And of course, the first smart action that you can take is knowing what your health insurance policy covers. And as you can see, it's an important element because it explains the cover services and benefits. It outlines the cost associated with the plan, tells you how to find in-network doctors, and it also explains how to dispute a billing error. And so as we talk about this, I'm going to share a little story with you. And the story goes like this. And Lynn works on the family farm. Luckily, Lynn's spouse carried the health insurance coverage. As part of Lynn's coverage, there is Preventive Services. Lynn used Preventive Services to get a physical to ensure good health. During the exam, the doctor found a spot on Lynn's lung and ordered a biopsy. After the biopsy, they determined Lynn had stage 1 lung cancer. The cancer had not yet spread, and they were able to remove the spot as part of Lynn's lung to make sure they got it all. Lynn is now recovering and is cancer-free. I was told the health insurance plan paid for most of the costs, including x-rays to diagnose, the surgery to remove the spot, and then a couple of days in recovery Lynn needed before coming home. If Lynn and the family had not had health insurance that included these important health benefits, then the health problem could have cost the family thousands of dollars, and if left unattended, Lynn may not have recovered so quickly. So how did this story relate to important health insurance benefits, essential benefits? You know, there's that component. Well, at first, you know, the preventive service and the wellness visit, the preventive service was able to identify the spot in this particular case. From there, Lynn, you know, had to go to the doctor and get the lab test, and then have the hospitalization that went along with it. The prescription drugs, you know, needed for recovery, and then continued outpatient care. These are some other essential benefits. And And I know there's a lot of discussion around essential health benefits right now, but it's important for you as a consumer to make sure that you're aware of the essential health benefits that go along with your particular plan. And so, again, some of those other examples you can see there are maternity and newborn care, mental and behavioral health, pediatric care, emergency room services. Those are all important things that you need to consider as you're deciding what health insurance plan that you need and what is covered by your health insurance plan as well, because you may have to make a decision that you need a different health insurance plan. So where do you find all of this information? You can find that in a document that's called the Evidence of Coverage document. Often you receive this when you sign up for health insurance cover, but if you don't receive it, some insurance companies just post this on their website, and so you can go to their website, look for the evidence of coverage, and it's going to outline, again, the coverage that they are providing to you with your health insurance. The second smart action that you can take is to have your proof of health insurance at all times. Why is that? And you were talking about your health insurance card. It gives the provider access to your policy information. And, often when you walk into the doctor's office, they ask for your insurance card. It outlines the copayments that go along with it, and it also provides a contact number if you have questions. And so, as I mentioned, this is on your health insurance card. Here's a sample health insurance card, so you can see, your health insurance card is going to have your name there with number 1, your member number and your group number 2 and 3 listed on your screen there. And 4, it's going to talk about which type of plan you have. That was something we covered there in the important words to know. 5 is going to cover how much your copays are. 6 on the slide here, it talks about your member services number. So if you have questions, you can call that number and get your questions answered. And then 7 has your copays with your different types of prescriptions. So you can see there's often a difference between what you pay for a generic prescription versus a name brand prescription. Smart action number 3 is choose in-network doctors. Why is this important? Because often plans have a different charge for in-network doctors versus out-of-network doctors, so you can save money. Where can you find this information? You can, again, that evidence of coverage should help guide you as to where you can find this information, but often if you call that 800 number at the bottom of your insurance card and call them and ask them, they will let you know. And you do need to be aware of in-network doctors, because you may go to an office and some doctors are part of the network, some doctors are not. Or if you go get a lab work, get an x-ray, and there's a doctor that is reviewing that x-ray, you need to make sure that that doctor is part of your network as well. So sometimes you have to ask some additional questions to make sure that the doctor that you're actually seeing is part of your network. Smart action number 4 is taking advantage of those preventative services. Again, the preventative service, taking advantage of what your plan offers, is going to avoid costly issues later on. It helps prevent illness, things such as flu shots, again, prevent you from getting sick and being out of work for a week or 2 weeks. And where do you find some information about these preventative services? You really have to ask your insurance company, because like I had mentioned earlier, we're currently operating with the Affordable Care Act with these essential health benefits, but there's a lot of discussion and transition, and so the best place to go right now is to just make sure that that is in your evidence of coverage and make sure you're using the preventative services that are available to you. Smart action number 5 is track your healthcare expenses, and you need to make sure that there's several reasons there in terms of tracking your expenses, first, you want to make sure your medical bills are right. Different studies have shown that there's billing errors anywhere between 30 to 80% of the time, and a lot of that has to do with how things are coded. So you want to check your medical bills, make sure they're right, make sure that you're actually receiving the services that they're billing you for, preventing medical ID theft. So when you get your explanation of benefits, you can look at that and say, okay, wait a minute, I wasn't on the doctor on this particular day. Why is there a charge here? And then you can look into that. Again, it provides proof when you track your healthcare expenses. And then, you should look at this year to year. So collecting information throughout the year can help you decide which is the best insurance plan for you for the following year. So it helps from a planning perspective. So where do you find this information about expenses? Let's see here. And again, there's a sample of a bill there. But again, you just need to start to track your healthcare expenses so you can plan for the following year. Having a system and organizing your expenses is important. For me, I still do that, with a filing type system, and depending upon what system works for you, you may use a spreadsheet, you may use folders. You might want to keep your prescriptions in one area, your dental issues in one, your vision issues in another area, your explanation of benefits form in one area. Even my medical receipts I'd put into 2 different areas because I have a flexible spending account, and so what I charge against the flexible spending account using the credit card they provide me, or the card they provide me, I keep in one area. The ones that I paid out of my own pocket, I put in another area, so that later on when I seek reimbursement for them, I have the 2 separated up front. Smart action number 6 is estimating your healthcare cost. And why is this important? Again, it just becomes a part of the budgeting process, and this allows you to make sure that you have enough money to cover those out-of-pocket expenses, that you're able to pay for the healthcare services that you need, and that, again, by having the money to pay for these things and using the services that are available, you're able to get and stay healthy along the way. So how do you find out to estimate your healthcare cost? You can look at the explanation of benefit statement that contains that information. That includes your charges. You can use medical receipts. You could use your credit card statements, and the flexible spending account documents also would track that information for you. So those are all tools that you can use to estimate your cost for the following year. And I'm going to share with you afterwards a document, and again, this is a fact sheet that says helping make good guess out-of-pocket health cost. And you can see it's just going to tell you some things that you need to consider there. And it's also going to give you a little grid here in this area, give you some line items to think about. So think about your premiums, your expenses paid towards your deductible, co-payments, co-insurance, prescriptions. All those items are things that you can track throughout the year, and it's going to help you decide, again, is the coverage that you have currently the best thing for you next year. And I'm also going to be sharing with you an estimating healthcare cost document that will be part of the emails that go along with this presentation. And again, this is just that a fact sheet that I had shared with you a minute ago. And smart action number 7, of course, why is this important? So using the tools that you have to solve the problem that helps you fix billing errors. It makes sure that the insurance company is paying for the covered services. You know, as we mentioned, 30 to 80% of the time there's an error, so making sure that you are keeping track of things is an important element of utilizing and being a smart user of your health insurance. And then in emergency situations, knowing this information we discussed today is going to help you in terms of being able to get a quick response. So this is just, again, going over these tools that you need to be aware of, your evidence of coverage, your medical bills, where to go for in-person assistance. You know, if you use a navigator, again, knowing where those navigators are and are available to you are all important pieces in terms of tools that you need to be aware of in terms of using your health insurance. And as a result of all this, you know, what I want you to do is walk away from here and say, I'm a smart user of health insurance, that I'm going to go and I'm going to review my health insurance coverage, that I'm going to make sure that I carry my health insurance ID card with me at all times, that I'm going to take advantage of these preventative services to stay healthy. And again, staying healthy keeps you from missing work. Making sure that you're using in-network doctors in facilities, again, just another cost-saving measure there. Start to plan and track your healthcare costs so that, again, you're making sure that you have the best insurance coverage that meets your family situation. There are many different products out there, and making sure that you have the right product for your healthcare needs is important. And then, again, making sure that you know where those tools are, the evidence of coverage, documents, contact numbers, those types of things, so that when you have a problem, that you are able to solve the problem. So here are some action items that I included for farmers. You know, as I mentioned in the beginning, you've got to start thinking of, if you don't already, make sure that you start thinking of health insurance as part of your farm's risk management plan. Again, you don't want the unexpected cost of a health issue to affect your farm operations. Make sure that you're comparing the cost of insurance plans. You know, like I said, there's several different options out there, and you've got to choose the option that best meets the needs of your particular situation. You should take advantage of pre-tax savings programs, you know, things like that health savings account and the flexible spending account. And if you have non-family employees, consider that health reimbursement account as part of your benefits package. Again, the tax savings element is important. So now we're back to the survey. If you could open back up the link that where you completed the pre-survey, just if you didn't click on next, you can click on next. It'll give you the post-survey, and if you can answer the couple questions quickly, and then when you're finished that, just acknowledge that in the chat box. So again, I'll give you a couple minutes to do that. Same time, if you have any questions, you're welcome to put those in the chat box. I'm more than happy to answer any questions you may have. The next slide, I'm going to share with you some reliable resources. So as you're completing the survey, I will be sharing with you some places you can go to get some additional information. And a lot of these documents that I referred to, like I said, we'll be emailing them to everyone, but you can also find them on some of these resources that I will be sharing once I know that everyone has completed the post-survey. All right, looks like we're good there. So again, some links that you can go to for additional information. We have our Health Insurance Literacy Initiative team is hosted at the University of Maryland Extension at extension.umd.edu/insure. And a lot of these fact sheets that I covered today, you'll be able to find at that particular link. You have Healthcare.gov. Consumers Union is a good place for information. And then you also have, Medicare and Medicaid services. If you have questions, that they have some answers there. They also have this coverage to care roadmap. So great resources. And like I said, these links will also be in the PowerPoint that we'll be sending out as well. And so there's my contact information, jketterm@umd.edu. My colleague Maria, she'd also be more than happy to answer any questions that you have. And I do need to acknowledge some of my partners that assisted in the development of this program: Bonnie Braun, Virginia Brown, Lynn Little, Teresa McCoy, Mia Russell, Christine Garcia, and we already mentioned Maria. So many thanks to them for helping put all this together. And they've all been part in some way with the Health Insurance Literacy Initiative that we have. And that concludes my presentation. I want to thank you for being part of the Smart Actions for your health insurance. And like I said, we're going to be sending out the PowerPoint as well as the fact sheets and the documents that I kind of shared throughout the presentation. And now I'll turn it back over to Shannon to kind of wrap things up from her end. And again, I thank Shannon for allowing us to do this presentation as part of her series.